Many of you are expected to see funny in the beginning of my videos. There's nothing funny about anemia. Except it rhymes with screamia. Wait, that's not funny either. Was it? It was? Okay, let's use that then. Dr. Michael Berglund, welcome to Common Sense Medicine. Today's subject, anemia. There are 7 different reasons why people get anemia, and that's what we're going to talk about today. The first and most common one is iron. Iron deficiency anemia. Typically when we look at these on the microscope, they look like pale cells that don't have enough color in them. The color is actually hemoglobin. Hemoglobin is the protein that iron sits in the middle of. That's important to know because hemoglobin carries oxygen from the lungs to our muscles to the tissues. That's how we transport oxygen in the body. It's very important that we have that hemoglobin or we can't carry oxygen, and people get tired, they get lethargic, they can even get blue fingers sometimes. In that hemoglobin molecule is also copper. Most people don't think of copper and anemia, but you can have a copper-induced anemia. Most people in our culture have plenty of copper. We have copper pipes, we have a lot of sources of copper, and there's very small amount of copper that's necessary for a hemoglobin molecule. Most anemias are not copper-based. There's another kind of anemia, and that's a B12 anemia. B12 anemia will result in a deficiency of B12. Oftentimes, if this is allowed to go all the way to the disease state, it's called pernicious anemia. Pernicious anemia is what it is, sounds like it's an anemia, so there's a low amount of red blood cells in this system. The challenge also is B12 is also necessary for nerve growth. What happens a lot of times is they'll get like numbness or tingling in the legs and the toes and the fingers, and because of that they call this pernicious anemia, and it's considered a neurological condition also. There's also folic acid. Now folic acid and B12 are required to help a red blood cell mature. When a cell is immature in the human body, it starts off big. As it matures, it gets smaller and smaller. It's kind of opposite that we would expect. B12 deficiency and folic acid deficiency, when they're not there, the cell's growth is stunted. Therefore, these cells that are mature red blood cells actually are bigger because they've had their growth stunted. The last thing I want to discuss that oftentimes is missed is spleen dysfunction. I talk about spleen in another video called Spleen 101. If you want to learn about the spleen and everything about the spleen, refer to Spleen 101 and we'll talk about it. For this purpose, what you need to know is the spleen is responsible for one of the organs responsible, including the bone marrow, for healthy red blood cell production. The reason I want to give this video is a lot of people think anemia, if I'm anemic, I just need to take more iron. It's so much more involved. B12, folic acid, iron, copper, vitamin C, spleen, B6. There's a lot of things that can go wrong. I encourage you to seek your doctor, seek an alternative care practitioner that's going to look at all the different kinds and not just throw iron at you. Thank you for joining me on Common Sense Medicine. Today's subject was anemia, and I hope that I've helped you. There once was a girl named Anemia, whose brain was so